Hello, I'm Dr. Ken Landa, and let's talk about treating diabetes, and specifically using a drug known as Invokana. Diabetes, obviously a very common condition, about 35–40 million people in the United States with diabetes, and we seem to be losing the battle. As the waistline increases, so does the likelihood of developing diabetes. There are about 52 million people in the United States with pre-diabetes. Current trajectory, those people will be diabetic if they don't do something. We spend about $350 billion to take care of diabetes in the United States, and we're not doing a very good job. It's estimated by the Centers for Disease Control that probably somewhere around 1 person in 9 has diabetes and 1 person in 3 has pre-diabetes. Now we have a relatively new pill. It's known as Invokana. It was the first in its class. It was originally developed by a Japanese concern, licensed to an American company, Janssen Pharmaceuticals, owned by Johnson & Johnson, approved for marketing in March of 2013. Different from other anti-diabetes medicines. It was going to be the second, actually. Farxiga was going to be the first. But in 2012, Farxiga ran into some problems at the Food and Drug Administration with concern over liver damage and bladder tumor and breast tumors. Subsequently, it's been approved. Invokana was approved in March of 2013 to be taken before the first meal of the day. And the way it works is it doesn't change the insulin level of the body or any of the other hormones. It simply makes the kidneys pass out the sugar through the urine. Well, the approval of all of these drugs, any drug, it doesn't matter what the drug is for diabetes, it's approved on the basis of how much it lowers the sugar. And all of them lower the sugar basically by about the same amount. Unfortunately, the Food and Drug Administration doesn't really pay that much attention to what's going to be the fate of people with diabetes. Or is it going to reduce the likelihood of them having a heart attack? That's obviously why most people with diabetes die. It isn't because the sugar is 200. It's because the sugar or something is playing foul with the inside of the body. So the way you take the drug is you take 100 milligrams, 1 pill, before the first meal of the day, assuming you have relatively good kidney function, because remember, the sugar is going to be passed out through the kidney, and that's the way the medicine works. You can take it by itself, or you can use it in addition to some other diabetic medicine, and as a matter of fact, it's sold in a pill combined with metformin. Now, it's important to realize that about half of all of the people who take diabetes medicines are unsatisfied because they don't reach the appropriate level of sugar control. Almost any of these medicines reduces the blood sugar or the glycosylated hemoglobin that we use by about the same amount. If we look at the drop in blood sugar, it's about 30 points. If we look at the drop in the hemoglobin A1C, it's about 0.8%. Well, these drugs aren't necessarily the safest things in the world. So it was approved, as I said, in 2013, and by 2015, the Food and Drug Administration had advised it on at least 4 major concerns. So after the approval, they found that the drug increased the risk of bone fractures, decrease in bone density, especially of the spine and the hip. It seems to increase the likelihood of fractures from minimal elevation from standing height. It causes ketoacidosis, a buildup of acid in the system. It causes, in some patients, kidney failure. And in some people, they develop life-threatening infections. Overall, the side effects are the same as with Jardiance. So Jardiance and Farxiga and Invokana, all the same family of drugs, causes an increased amount of sugar going out in the urine. The sugar is going to pull water, and that means you're going to urinate a lot. So increased urination, polyuria, is a problem, and that can lead to dehydration. And especially dehydration if you're on a low-salt diet, if you're taking a diuretic, maybe if you're a relatively thin individual, going to increase your risk. And then if you, unfortunately, develop dehydration, hypovolemia, not enough fluid circulating in the system, so when you stand up, you can become dizzy or faint or fall. And then that obviously increases the likelihood of having a hip fracture or some other bone fracture. And all that sugar going out in the urine can increase the risk that you're going to develop a yeast infection, genital yeast infection, men and women both, foul-smelling, red, swollen area, unfortunately relatively common. hypersensitivity reactions, hives and urticaria, sometimes the skin falling off, all not uncommon. And then in the first 30 days of taking the drug, there's increased incidence by about 50% of developing a stroke, probably because of the dehydration, maybe because of some other reason. We know that that's not uncommon to find problems. So Avandia had been on the market for about 9 years before it was found to increase the risk of heart attacks. When I mentioned ketoacidosis, what is it? It's an elevation of your blood sugar, an elevation of your blood acid that causes symptoms like nausea and vomiting, abdominal pain, shortness of breath, and malaise, tiredness. You are predisposed to it if you drink a fair amount of alcohol, maybe you have some pancreatic disease, or maybe you've just become ill with something else. Maybe you've cut down the amount of food, the amount of calories you take in. Maybe you have some kind of febrile condition. And we know that it can lead to kidney problems and kidney failure. And people who take this drug can have an increase in their cholesterol, an increase in their potassium. And we know that even though it's not marketed specifically as a weight loss drug, we know if you're losing a lot of sugar, well, sugar is calories, so you're going to lose some weight. Maybe about 3% of your body weight can be lost taking these drugs. And even though it's not a blood pressure pill, it seems that when the sugar goes out and it takes the water with it, it also takes sodium with it. And as a result, your blood pressure can go down. So it may well be that this kind of medicine is good for long-term survival because it treats your obesity and it treats your blood pressure. Well, Johnson & Johnson was told, hey, after you get approval for this drug, you better do some studies. You better look and see what happens over a period of the next 4 years as far as heart disease and liver disease and cancer and pancreatic disease is concerned. All very good idea, of course. And they were shocked to learn just on May 18, 2016, so just very recently, it was found, first by the European regulators, then by the American authorities, that Invokana might actually increase the risk of amputations. And it seems like it increases the risk of amputations by 2- or 3-fold over people taking a placebo, maybe because they're dehydrated, maybe because there's not getting enough flow of blood to the tissue. There is another study that only lasted 9 months. The one I talked about, the Canvas study, lasted a year. Well, in the subsequent study, over a period of 9 months, maybe there wasn't the increase in amputation, and there's no direct cause and effect link that so far has been established. But we know people with diabetes have a higher risk of developing foot ulcers at some period in time. About 15% ultimately are going to get a problem like that. That increases the risk of amputations anyway, so the Food and Drug Administration says, hey, you have a sore, you have an infection, you have an ulcer, especially about the extremity, go and talk to your doctor. And we know that if you happen to have type 1 diabetes, the juvenile onset diabetes, the diabetes associated with the lack of insulin in your body, well, that increases the risk of that ketoacidosis, so it's only for type 2 diabetics. Now, the head of the Yale University School of Medicine Diabetes Center, he says we can treat you for a month for $4, or we can use some of these new pills that cost $9, $10, $11, $15, $17 a pill. And as a matter of fact, even though the price is 100-fold greater on some of the medicines, you don't get 100% more benefit, 100 times more benefit. You just don't. As a matter of fact, the benefit seems to be basically the same. How much does this drug cost? Well, if you take Invokana and you pay cash for it, it's about $17 a pill. If you go and have a coupon, maybe it's somewhat less. Now, they have a savings card. The company makes a savings card. And they say that if you take this in, then you don't have to pay the copay, or you pay a reduced copay. But some people say, and some authorities say, hey, that's not ethical. That's not appropriate. So you can't use that if you have Medicare, you can't use it if you have Medicaid, can't use it if you have TRICARE. And if you go online to Invokana, you'll find an enormous number of lawyers advertising for all of the different kind of lawsuits against the company. So when it comes to diabetes, how should you treat it? Number 1 is diet, number 2 is exercise, and then have a long talk with your doctor about whether all of these new, very expensive drugs are really going to benefit you more than taking some of the older, very inexpensive generics. Anyway, something for you to consider. I'm Dr. Ken Landau. Thank you for watching.